Hello, my name is Mary, and I'll just be very brief in my introduction to the bladder system. It's part of what you need to know to pass your test that qualifies you as a personal care aide. And your job is very important, and we appreciate what you do. And first of all, on the drawing here, we have the bladder is a pear-shaped organ. These are the ureters, and these are the kidneys. And the kidneys flow the urine into the uterus and out to the bladder. A bladder typically holds 500 to 600 mils of urine. And a lot of the problems that can happen with some of the patients that you're taking care of is that they either have less muscle in the pelvic organs, or they have a neurological problem, like they had a stroke or some kind of neurological disease. And so you're going to run into some types of incontinence that you need to know. And the first one is urge incontinence. And that basically says that they have the urge to want to urinate, and they don't completely empty out their bladder, and they dribble, or they have some urine output that they soil. And then the other one is called stress incontinence. And that one is when coughing or sneezing or lifting, that they could have leakage. The other part is overflow incontinence, and that one is where the bladder doesn't completely empty out, and so there's still some retained urine in there that could lead to an infection. Speaking about infections, you need to be very aware to wash your hands. Good hand hygiene is always the best. You don't want to introduce an infection to your patients. The other thing is you always want to clean front to back. You don't want to introduce any kind of fecal matter into the patient, so where they could also get an infection of some sort. Some of the incontinence supplies that you need are going to be the Chucks pads or Peri pads that go on the bed. Bedside commode is also necessary. Sometimes you can actually help them get up and use the bedside commode. Adult diapers. Sometimes they'll have a catheter that helps the urine flow, and that way you'd have to make sure that that's emptied. So all these things are very important for the well-being of your patient. And all these things I'm going to just go through so that you'll know that that's going to be on the exam. For example, the types of incontinence is going to be urge, stress, or overflow. You want to always clean front to back. The bladder holds 500 to 600 mils of urine. Thank you for listening, and I hope that you have good success in the care of your patients.